Hello, my name is Dr. Rebecca Wara-Goss. I'm a licensed marriage and family therapist, and my PhD is in East-West Psychology from the California Institute of Integral Studies, located in San Francisco, California. I specialize in transpersonal psychotherapy treatment, which utilizes the mind, body, and spirit approach in counseling treatment, treating disorders such as depression, anxiety, and trauma stress-related disorders such as PTSD. I'm the owner and founder of my private practice for in-person or teletherapy sessions with clients called Eudaimonia Connections Counseling Services for mental health treatment and transpersonal wellness. And last year I founded my nonprofit, Eudaimonia Equine Connections, Inc., with the goals of creating my own equine-assisted mental health treatment program, clinical program for in-person sessions with clients, and also created a equine-assisted mental health research program, which will include my academic journal, Journal of Equines for Mental Health, and also research design and consultation for researchers nationally and or internationally that are interested in conducting equine-assisted mental health related research and would like assistance with design and implementation of their research. If you would like to request to have additional information or have questions about my clinical or research programs or academic journal, at the end of my presentation there will be a slide with my contact information and websites, and you're welcome to contact me that way. I have been a lifelong lover of horses since I was a child, and as an adult professional, I am passionate about horses and their potential to assist us humans in multiple capacities, in particular in the mental health and research fields. Hence, the focus of my presentation today here at HETI 2021 International Conference in Seoul, South Korea, will be on my abstract for my doctoral dissertation research. My dissertation title was Horses Healing the Wounded Warrior, a qualitative inquiry of equine facilitated psychotherapy in treating PTSD for female veterans. Overview of my research is why did I choose to do this study? Was because I wanted to find out how equine facilitated psychotherapy treatment may impact veterans with PTSD, and which PTSD is often very difficult to treat, and how the interactions with horses may or may not lead to positive changes in mental health and well-being. My study was exploratory qualitative inquiry that examined the lived experience of women veterans with PTSD who participated in EFP treatment, and I was interested in the interconnectivity of the human-animal bond. I consider transpersonal psychology to be the best fit in which to examine this phenomenon. My research question was, what is the lived experience of EFP and female veterans with PTSD? It was intended to address how the relationship interactions with the horse in EFP may affect PTSD symptoms for veterans. My research was designed as an exploratory qualitative inquiry. I used semi-structured interviews in order to gather in-depth descriptions of their experiences, and then did thematic content analysis in order to discover what themes may have been found, and that's what I used for my results. Participants that were invited to be part of my study were women veterans that had served between 1990 and 2016, who had a verifiable diagnosis from a professional that they had military-related PTSD, and had participated in some kind of EFP treatment program within the previous 3 years prior to the time of the study. I collected data using in-person and phone audio recorded, open-ended, semi-structured interviews. I used goddess pseudonyms and a variety of ways to try to make sure I protected the confidentiality and any identifying information of my participants. I did my best to ensure validity checks within qualitative standards, using descriptions and of experiential experiences my participants shared to the best of my ability. So some information about my participants who volunteered to participate in my study where there was a total of 10. The women were from 7 different states in the United States. Their ages were from 30 to 59. The majority were Caucasian women. Some were Hispanic, and one did not want to identify as one race, but as multiple. Their time in service in the military ranged anywhere from 2 to 29 years, with an average of 9.2 years. Majority of the participants served in the Army, followed by the Navy, the Special Air Force, and the Reserves, with several participating in multiple branches of the military. 9 out of 10 participants reported military sexual trauma, with the majority reporting rape and sexual harassment, in addition to other forms of sexual assault that they had experienced. All participants reported prior psychotherapy experience. All participants received multiple treatment interventions with a combination of treatment provided by the VA or in private practice, or some had inpatient treatment. The majority were taking psychotropic medications. All participants had participated in some form of equine therapy from an organization that had been recognized nationally and internationally, such as PATH International or EGALA. And a majority of participants had EFP treatment with other women veterans, so in a group therapy format. And some had individual therapy, and some had more like a one-time retreat experience. So the results from my interviews and my thematic content analysis included a broad range of 33 themes that were found. And I did my best to group those 33 themes into 6 major theme groupings, which include experience of the horse-human relationship, interviewee perception of supportive behavior, beneficial experiences from EFP treatment, impact on PTSD symptoms, additional factors to consider in treatment of military-related PTSD, pre-EFP treatment military-related experiences. Significant findings were themes that had 5 or more participants that were included from the 6 theme groupings that I just mentioned. And so of those were considered the 11 significant themes. Those included emotional discomfort with the horse, spiritual experience, experience of safety, visual contact, emotional connection with the horse, beneficial impact of therapy, increased connection with others, reduced anxiety and withdrawal, EFP advocacy for others, and delayed awareness of PTSD. These findings were consistent with the interconnectivity variables in transpersonal psychology. Majority of the participants experienced short-term and or long-term benefits of the reduction of their PTSD symptomology that transferred from EFP sessions to their everyday lives. Majority of participants' experiences in EFP were profound and made a bigger impact on their PTSD symptoms and general well-being than the VA treatment or traditional office-based therapy approaches had. Contributions of the study were that it was the first study of its kind that asked female veterans to participate in interviews about their lived experiences participating in EFP treatment. It revealed invaluable insights into the healing power of horses, and it became understood that interconnection between species, such as a horse and a human, was understood to be a non-verbal energy connection potential from one being to another. And it was looking beyond just the physical world, but opened up consideration for spiritual experiences that were evoked through relationship with a horse. Implications of findings were that EFP was helpful for all participants in some way. It provided hope that healing and reduction of the severity of PTSD symptoms was possible. Connection with horses was a catalyst for participants to experience emotional safety and become open and motivated to work on themselves beyond EFP sessions in order to try to get better. It demonstrated the voices of women whose self-reported shifts they noticed and felt reconnecting with who they are and their loved ones, demonstrated the power of their lived experiences participating in EFP. In closing, the significance of the bravery of these women to share their stories with me and to help advocate helping other women who experience MST was powerful and extremely moving. Their stories and lived experiences of EFP are part of the growing movement to help other MST victims and to advocate to the U.S. military to be aware of why these incidences happen, to have prevention and safeguards in place, to have restitution and integrated treatment options for post-MST victims. In addition, advocacy to increase awareness of impacts of MST and military-related PTSD that includes integrated treatment options such as traditional office-based counseling, but in addition, alternative-based counseling such as EFP. As I mentioned earlier in the beginning of my presentation, here is my contact information if you would like to have a copy of my dissertation, or if you have any additional questions or would like more information, please feel free to contact me. It has been an honor to be here and to present at the HETI 2021 conference in Seoul, South Korea. Thank you so much for having me. 감사합니다. I wish you all a blessed day and enjoy your time at the conference. Thank you again.